up here on the table here, like that.
It's not uncommon for mom Laura Lapata to take daughters Emma and Elodie to see licensed acupuncturist Jill Blakeway on the same day as a pediatrician appointment.
He'll look and he'll say, you know, it's some unspecified virus, she'll get over it, whatever. 2 or 3 hours later, I've had an appointment with Jill. We take her down and Jill says, that's a virus and it's called half in, half out, and this is how we're going to treat it. And literally within the treatment, the color starts coming back into their cheeks.
Plant a little flag, leave it for just 1 minute, and then we pull it out. We treat children for a wide range of ailments, really, childhood ailments. We start with little babies with colic, and people are often surprised to find out that we treat babies so young with acupuncture. It's just 2 very tiny needles, they barely feel it, and for a lot of mums it is the solution. How have you been this cold and flu season? Have you had a cold?
Yeah.
Yeah?
I had one a couple weeks ago.
And how are you doing recovering?
Better.
Better. That's great. Do you have a cough still? Not really. We also treat respiratory issues, asthma, repeated ear infections. Chinese medicine can be wonderful for repeated ear infections, and a lot of children get into this cycle where they end up taking antibiotics over and over again. Chinese medicine can often interrupt that cycle. So we're going to give you a little boost today is what we're going to do. We're going to boost your immune system, we're going to boost your qi, as we say in Chinese medicine, so that you can do all this homework you're doing. We always encourage people to see their pediatrician. Clearly the pediatrician is there for immunization, is there for serious issues, rapidly changing issues, and Chinese medicine is more useful for things that are chronic, long-term, and slow changing.
That helped a lot.
They love coming here. Who wouldn't love coming here? Jill is wonderful, the staff is wonderful, you see how comfortable the space is.
We try and make this as unintimidating as possible. With a child, we'll probably sit and chat for a while. How's school?
Good.
It's
Kinda
good.
hard, though.
We don't talk about needles, we talk about planting the flag, and we talk about the tickle machine.
Emma doesn't really like needles, so Jill uses the tickle machine, a device that electrically stimulates the skin, mimicking the effects of the acupuncture needles.
Well, there's the tickle machine. It probably has some scientific name, which I have no idea what it is, but the tickle machine helps too. I don't know how it helps either, but it helps a lot.
Jill says she relies on a good relationship with her young patients' parents and a keen eye to help her treat children.
With children, I rely much more on my observation and less on their reporting, of course. Grown-ups can tell you what's going on. Children often don't have the vocabulary or the insight into their bodies to explain how they're feeling.
So look, Elodie, we're going to use the tickle machine on you. Does it make you laugh? Because it's tickly? Does it feel good? What does it feel like?
Ticklish.
Laura says she's seen definite changes in her kids since they started acupuncture.
They're more grounded, they're calmer, and Emma, especially as she is 10, is able to say, you know, Mom, I kind of feel this anger is welling up inside me. I think I need an appointment with Jill.
If I feel like angry a little bit, like sometimes, it helps. I don't know how, but it helps.